worrying. The total number of cases have crossed 2 million, 20 lakh cases yesterday. Yesterday, the largest number of cases per day, 62,000 were reported. The deaths are also one of the highest reported. And there seems to be no slowing down of the spread of the disease. We need to wonder why, despite such a lot of hue and cry, such a lot of lockdown measures, India continues to fare poorly. Currently, we are generating more number of cases per day and having a greater rate than all the major countries. There are Latin American countries and South Africa that are on the same boat, but we are doing very poorly. Much of this rests upon the fact that our existing healthcare system has been very weak. And there are 4 dimensions on which it is weak. We are one of the world's worst funded, one of the bottom 10 in terms of public health expenditure as a proportion of GDP. The last 10. This in turn has led to one of the lowest proportions of human resource for health deployed and in the public service. So it is extremely weak public service because of human resource deployed. We have an extensive primary care network, but it has been restricted to a very, very narrow range of services. Just a bit of antenatal care and immunization and tuberculosis and HIV, but almost most areas of diseases where it has not really started up, except at some 10% of centers perhaps. And finally, we also have an issue where even the hospitals are minimally designed with overflowing far lesser number of beds than what we require. And therefore, when there is a surge of requirement, we are completely unprepared to manage this surge. The whole principle has been to keep public system restricted to the minimum possible and leave the rest to the private sector in terms of services, in terms of capacity, in terms of the type of people served. So as a result, when you have a pandemic, we are doing very poorly.